Despite the challenges facing the country today, government is committed with the implementation of national health insurance come January. Good evening, everyone. I'm Charisma Robinson.
And I'm Chris Saunders. Thank you so much for joining us. Prime Minister, the Right Honorable Perry Christie, has taken on the chairmanship of the National Public-Private Sector Task Force, responsible for the phased-in implementation of N.H.I. Today, he invited the media into one of their planning sessions to ensure transparency and accountability becomes the hallmarks of this project heading forward. In fact, Mr. Christie told our Clint Watson that keeping the public informed of developments and decisions will be critical for a successful implementation.
All the fine print and details to the phased implementation of national health insurance are being worked out as government prepares to begin this universal health care reform in less than 3 months. Prime Minister, the Right Honorable Perry Christie, adamant that N.H.I. will indeed happen as too many Bahamians are in need of medical assistance.
The government, in its approach to national health insurance, has been particularly mindful of the challenges to health of the population of our country. The Bahamas leads the region and possibly the world in the incidence of diabetes in our population.
Critical to N.H.I. implementation will be shoring up the infrastructure at the Princess Margaret Hospital, Grand Bahamas Ryan Memorial Hospital, and local clinics nationwide. There's been mounting concern from the Medical Association and the local insurance industry on the government's financial figures to administer N.H.I. compared to what they suggest. Therefore, the Prime Minister secured the services of PricewaterhouseCoopers as well as Sanagest, who will advise what type of insurance to offer.
The government has articulated the rationale that it would not charge the people of the Bahamas at this stage in the first phase, because I'm now talking about addressing the disparities in healthcare, where those who have money are able to buy what they want, and those who do not have are faced with the perilous situation that involves whether or not they live or die.
A key component to N.H.I. will be enforcing a strong preventative program to complement the healthcare system. He says his administration is cognizant of every sector of the economy. The Prime Minister maintains consultation with the Medical Association and insurance industry is vital.
Even if it means the introduction of a hybrid system, one that takes into consideration the economy of the Bahamas, is adapted to the economy of the Bahamas, and therefore becomes a Bahamian model.
Deputy Chief Medical Officer Dr. Delon Brennan says when universal health care for all is discussed, answers to significant questions like who will be covered must be addressed.
The issues around universality, around equity, making sure that we introduce as comprehensive a package of services as possible, all aligned with the fact that we want to make sure that it's affordable and sustainable in the Bahamas, but based on a platform truly of being able to introduce something that is quality to the Bahamian people, and that we continue to maintain that quality as we move ahead and we continue to introduce national health insurance here in country.
The Prime Minister wants to avoid at all costs a new Providence or Grand Bahama-centric focus to N.H.I., but rather one that covers the entire country. Clint Watson, ZNS Network News.